In this video, we're covering hip pain, specifically hip impingement syndrome, and the top 3 exercises to figure it out. Let's go. What's up guys, Amar here from EverStrong Therapy, your partners in health and performance. Today we're covering hip pain, specifically hip impingement syndrome. Now hip impingement can be a host of things, but essentially a hip impingement is a compression of the acetabular joint itself. So if this is your femur and this is your acetabulum, when it's supposed to be moving nice and smooth through there, a hip impingement is when this is jammed up into the joint. Now this can cause a lot of pain and a lot of problems in different movements. Most people tend to have issue and pain, sharp pain, right in their groin area whenever they go into hip flexion. So it also causes the muscles that surround the joint itself to get tight. And that again causes pain when we're standing up, when we're moving around. It can just cause issue throughout the entire hip syndrome. So when we go through the exercise we're going through, the first part about it is relieving, trying to pull that out just a little bit to give ourselves some space within that joint to relieve the symptom. And then it comes down to building resiliency or strengthening the musculature that surrounds that joint in order to prevent that pain from coming back. Just like always, I'm gonna give you the disclaimer. If these exercises don't feel right, if they're not working, if you have questions about them, or if they're just not for you, it's important that you consult a healthcare professional that you trust. Somebody in the healthcare realm that has an understanding of anatomy and biomechanics in order to assess your individual program. If you live in Bellingham, Whatcom County, somewhere in the Pacific Northwest, give us a call. And if you're in Washington, we offer a free 30-minute consult to anybody that has questions or anyone that we can help feel their very best. With that said, let's get to the exercises. Welcome to the gym. Now, the first exercise we're going to talk about with regards to hip impingement is a mobility exercise in order to help open up that acetabular joint. So what I have here is I have a thick band tied to a rack, and this is going right in as high into my femur as possible, so right under my pelvis. And what I'm going to do is I'm going to give this some tension. I'm going to come out, and I want the band pulling me down and away, almost like a 45-degree angle out here. Because what we're trying to do is we're trying to open up that femur into the joint. I'm gonna get on my hands and knees. And what I should feel, or what you should feel, is a little bit of a pull of that femur. You might even feel this up in your butt as that femur is pulling out. So while this band is pulling my femur out and creating some space, I'm going to work into hip flexion as I lean back and create more of that position that might be causing some aggravation when you don't have the band pulling out. So from here, I'm just working back and forth. The other thing we have to keep in mind is part of this is also adding rotation. So once this becomes familiar, what you can do is you can start to work internal and external rotation of the hip just by swinging my leg, just by swinging my foot back and forth, almost like a windshield wiper, right? Same concept. I can work back into that sensitive area. Let's say this is where I'm a little gristly, and then I can start to go in and out here and almost create almost like WD-40. I'm just trying to create some space and move things around within those sensitive areas in order to allow me that window where I can be pain-free when I take the band off. On to exercise number 2. Now that we've built a window of pain-free movement from the first exercise where we gave the joint some space, now we're gonna put the hip through its entire range of motion, both from a flexion extension standpoint and a rotation component at the same time. So here's how it works. Essentially, I'm gonna start on my hands and knees, and what I'm gonna do is I'm gonna be here and I'm gonna externally rotate and go into hip flexion at the same time. So I start here, I'm gonna go all the way up into flexion and external rotation. From there, I'm gonna extend my hip, and as I extend, I'm gonna internally rotate my hip all the way. So I end in a fully extended, internally rotated hip position as I come back. Our hips like to be in external rotation and flexion and internal rotation and extension. So what we're doing is we're putting that hip through its entire range of motion in order to see have we fixed anything, are we in a pain-free movement compared to when we started. Essentially, did this window that we created on our first exercise actually do its job? So from here, I'm gonna sit, external rotation and flexion, come into hip extension as I internally rotate my hip, and then come back. right? This is gonna be a nice slow movement. Slow is smooth and smooth is fast. So we wanna go slow and use the musculature of our hip in order to control the movement. A few things to look out for. I do not want to use my back as a compensation to get range here. Because this is a slow movement, you wanna do about 5 of these, nice and slow, and you'll feel this. This is much harder than it looks. If you start to notice your back starting to move, you can put something on your back, like a phone, like a plate, in order to make sure that you keep that back nice and stable. On to exercise, numero tres. So our third exercise to treat hip impingement is actually gonna be putting everything that we've done up to this point together. What you should have done already is create some slack in the joint, and then the second exercise was working on rotation in order to help open that space up and turn on some of the musculature that surrounds it. Now we're gonna put it in practice by doing a lateral slide and lateral squat. So if you're at home and you have a hardwood floor, just grab a pillowcase or something in order to create some slide. But what I'm doing is essentially a single leg squat while I'm turning on all those muscles that we were just using in our second exercise. So from here, I'm gonna come down and back up, right? And you should feel this in your hip, both as you come up and on this side in my adductors, right? But I'm working on this side, I'm loading this hip. If this is the hip that has my impingement, this is the one I wanna focus on. So I'm loading this up as much as possible. I'm hinging down, I'm coming all the way down and back up. I could do a reverse lunge here and really work this angle, or again, I can go laterally. Wherever you feel the most musculature working your hip, that's where I would prioritize my attention and start to build resiliency in a system that may have been impaired to begin with. On to the outro. We hope you found that information useful and that it helped with your hip pain or your hip impingement or whatever it is that you're going through. Remember, if these exercises don't feel right to you, please, please, please consult a healthcare professional that you trust and can rely on. If you live in Bellingham or Whatcom County, I encourage you to give us a call because we, as always, offer a free 30-minute consult to anyone looking to move and feel their best. Thanks so much, stay ever strong, and we'll see you next time.